In terms of cases per capita, Iowa has the third worst rate in the country. We are only being beat by the Dakotas, North Dakota of which just implemented broad sweeping guidelines to protect their citizens. And we have been in this position for several weeks, and it is not a position that we want to retain. Part of what put us into this role is widespread transmission. It is a situation where mass mandates and other restrictions could have been put into place to prevent widespread disease. And quite frankly, that we didn't do enough early enough as numbers were rising despite our pleas to try to do so. Other things that are contributing to the picture, we now know that schools can contribute to surges. So we have to take care to protect our children and our adolescents. And we are seeing hospitalizations in those age groups where we had not seen that before. So taking precautions around all of the things that Helen emphasized, those family gatherings, keeping to that immediate family, making sure that everything that you did, and think back to the beginning of this pandemic before we knew what we know now, which is even more reason to stay home, to put those things back into place, to think about how am I going to navigate the next couple of weeks, limiting my movements, limiting my activities, completely restricting my interactions with people. What you do will make a difference in the data. It will help drive this down. And one of the most critical parts of doing this now is not just to, save Christmas. I wouldn't even be thinking to that. To me, what we have to try to navigate are the next couple of months. Our case rates are so high right now that if we don't drive this virus down to a more manageable level, what we're looking at in January when it gets super cold and we start to see influenza and other viruses could be catastrophic. So what we're seeing for hospitalizations is 4 times what we saw in the first peak. And January could even be worse than that. So it's imperative that we do as much as we can now in every society.